Can start again. Is here someone who wasn't here in the previous? Yeah. You were not. Okay. So we do small recap for you. You have already the handout. That's great. They are done in the way they can. All important slides are there, and now we are on the page 5. So you see, you missed only like 4 pages. So that's great. And it's the second slide on the first page. It's like the personalities of the mushrooms. And when you understand the complex effect of the mushroom, and not all of them are exerted on all occasions, but if the patient is matching them pretty well, these mushrooms have really miraculous effects. And the more they match each other, the mushroom and the patient, in terms of what is described there, the better it is. And also those they are holding hands, and we will come to this in this section, that these mushrooms for neuroprotection is pretty clever to use them together. So what is red when they are holding the hands, it's like their effect. They have, like, both mushrooms have the same effect. And what's in the color of the mushroom, it's a unique effect of the mushroom. So you can see the combination. Yeah, and now, we were going in the previous section, like recognizing or getting to know with the mushrooms. So we understand that when it's facing the illness or the condition, what the effect is likely to be. Yeah, and now we will repeat a bit of this, so you didn't miss much. So we were speaking about in this chart, there is a lot. If you obesity, it very often means inflammation, that the fat, because the fat structures, they are not washed by blood, there is not much of qi circulation, so of course there is no movement, they're getting something wrong, and Western medicine and science recognizes now obesity as a source of inflammation. And we have the good brain axis. So when somewhere is inflammation, it's very likely it will affect the brain, even directly or indirectly. And there is a really nice article from this group of Italian researchers, and they are featuring their hericium. Yeah, please. Yeah, just shout, Yeah, we want to share and spread the information, so that's fine, you are taking pictures. So what we would like you, that you really, sometimes anyone is not able to remember everything, but that you remember that, this is our forget-me-not flower, so it's a natural anti-inflammatory nutrition for the good brain axis. It also works directly on the brain detoxification, and it also works, as we were discussing in the previous part, in the guts. So it's hericium. Here are the Chinese medicine properties. So it's sweet and plain. Sweet sweet tastes nourish, creates harmony, and is slowing things. And the plain, the tan taste is able to work with the water, filtering the water and creating the flow. It's according to the Shenung Penschao Ting and the old concepts of the tastes like we have in, for example, in Shanghanlun. Nature is balanced, meridians, liver, kidneys, and this is important. It benefits all the 5 tongues, aids digestion, works against inflammations, helps to the transforming functions of the spleen, and also calms the spirit. So not only it supports brain, but it also calms the spirit. It's really nice to have these effects together. Very often, even in herbs, we have something which calms the mind, but it makes you a bit sleepy.
Excuse me, when you say the plain taste filters water, do you mean clear damp?
No, yeah, it's the Shen Shi quality. It's working with damp. I would have to look into the Nigel Weissman dictionary. What's the proper translation?
That's what it is. Percolates.
Percolates. Yes, that's it. Percolates. As a children, or when you separate things, you have this paper which takes out the water, but really it's like osmosis. It's not filtering something out. It's not done under the pressure. Like when you use the diuretics, it's really keeping what is clear and letting out what is turbid. You know, so that's the percolating. Yes, thank you, thank you. So yeah, and also the occult bleeding in the stool. It tells us something about how it works with the intestines, and also we had the effect against the Helicobacter pylori in terms of the ulcers in stomach. Here are some enzymes which are, according to the mycology research, hericium. Again, we cannot use the enzyme content just by itself. It's really necessary to understand the nature from the Chinese medicine point of view, as we talked previously. So here are some the Western medicine indications. So it supports the organism and the immunity, exhaustion, inflammation, support of T and B lymphocytes. It's used in it can be used in autoimmune diseases where the inflammation is part of the problem. It has the antibacterial effect, and there are studies on anti-tumor effects. It's really interesting that the mushroom has the balancing effect in terms of the anti-mutagenic properties, that really the body can control the growth, that it doesn't grow beyond what is normal. Tak. Here it's supporting digestion, liver and stomach. You see we are repeating what we were saying in the second slide you have in your handouts. So it's digestive problems, stomach functions. All the ulcers in stomach, hericium would be like a #1 choice mushroom. It can be even used as a prevention from too rich diet, which is creating, for example, belching, antibacterial and hepatoprotective effect. It's nice. Very often Chinese medicine formulas, herbal formulas, are accused of damaging liver, and with mushrooms there is strong evidence that they have a hepatoprotective effect. So even maybe with some formulas like I mentioned, the Xiao Chai Hu Tang, it might be wise to combine with hericium. And your question was?
Just wondered whether acid reflux would also be something.
Yeah, it would, when the person would match the mushroom as we talk already about. Yeah, just just acid reflux is not enough. Yeah, okay.
Can I just ask if you can distinguish between in vitro studies and clinical studies when we look at the list of indications?
Yeah,
Primarily talking about in vitro studies.
Yeah. But the thing is, with the studies, they very often don't distinguish between the subject's constitution, and they have like 40 people there, and the result is, for example, there are the evidence on the antiviral effect or the Helicobacter pylori. There is strong evidence even in the clinical stuff. Yeah. And on the mycology research laboratories, there are the clinical journals, and there are clinical journal articles on the mushrooms. But very often what we need, so we can use it and repeat it, which is really important. The scientific paper is not valid when it cannot be repeated. Yes. And we can repeat when we understand the TCM context. Only then we can repeat the result. Therefore, we are combining. For us, sometimes the Western science is just maybe limiting or confirming what we understand from the Chinese point of view. Yeah. So it's a good question, and I very often they sometimes I don't like very often the articles when you can see they get rid of the patients, but they were not suitable for the study. And this is what you cannot get rid of your patient, because it doesn't fit your concept, so then even the results are wrong, because they are, it's not average, it's really model. It's a model, yeah, bias, yes. So, and there are some citations at the beginning, at the end of the section, each section. So you will find there something, so supporting brain and thinking. So there are compounds which are attributed certain effects, like stimulating the growth of neurons, the NGF factor, and production of myelin. And so this is used very often in the for supporting the brain function. And again, autoimmune diseases where there's inflammation, hericium is a really good mushroom to use. Here are some tongues, and it's also important that with all these tongues you can use hericium. So even like a normal tongue with some coating lacking here, it's not very good to be seen. With some deep lack of yin, and there you really can see the heat. And this is what we were talking in the beginning about, that there was always the red tongue, but it's not necessary. So we can use hericium for harmonizing the stomach, for protecting the stomach against liver qi. Very often liver qi can go up. In that case, hericium is useful as well, but normally we would use formulas which take the liver qi going up or yang down. And then also liver qi can spread to the sides, which is when it attacks stomach. And hericium is also supporting spleen. So it has the concept of working with the organ which is attacking and protecting stomach and spleen on the other side. So both concepts are present there. And it's the case when liver are, let's say, in a normal condition, but the spleen is weak. So it's the Pisu Mu Cheng, and it's the case of weak spleen and strong stomach, and in stomach heat it's useful as well. So this is like hericium from the Chinese medicine point of view. It's its signature effects. It's really great hericium to be used in spleen deficiency without dampness. When there is a dampness, it would be clever to use it with something else in combination. It calms the spirit, and also because it works against inflammation and supports neuronal growth, it's good to use it before sleep. Very often with children, as we had the case study of the nervous child. That child can use it like the last thing before he goes to sleep. And it can balance the stomach, it can work against the inflammation, it can calm them, it can support the brain growth and detoxify the brain. It's a really nice thing, and it can be combined, for example, with all the formulas you might use for better sleep as well. When there's the stomach-liver disharmony, especially, then it's pretty useful. So it calms the spirit, but when you would have someone who doesn't match that maybe really strong liver, but not weak spleen, then you really need to clear or work more directly with the liver. So then the hericium would be too weak in its effect, So maybe you might want to use acupuncture or some formulas. That's what I said. Sometimes you need the bigger hammer. So it would be the Chinese medicine formulas. Those rude, shouting guys, with red face. That won't be the constitution of what we tried to describe with hericium. So, and here's, this is also important slide. According to the Chinese medicine, the hericium is ideal stomach combination because of these properties. We already spoke about all of them. And it can be combined with a fooling mushroom. Fooling is poria. Howelen? I don't know the proper English name. Yeah, poria. Indian bread. Yeah. Okay. Sorry? Sorry? Yeah, Poriakokos. Yes, 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 yes. Okay. It can be combined with acupuncture pretty well. So I think you understand to the points. So when there is fatigue, lack of appetite, then you can do something with acupuncture and have the patient, especially when they are of the deficiency type and nervous, then it would be great to combine acupuncture sessions and interventions with hericium eating at home. Again, you have these slides, so we just go through them. There's nothing. Yeah. Yeah, actually, this is where we, on the other hand, can have a mushroom for supporting brain and help the mushroom with acupuncture. So it will be like the mushroom first, with the aid of acupuncture according to the condition. Chceš k tomu, Zuzko, něco říct? Dobře. And there is a quotation from Naking: when the stomach is in this harmony, there is unquiet sleep. And we understand now where the hericium could help us. That the unquiet sleep can be from more reasons, but when it's stomach in this harmony, then it's hericium. And contraindication of hericium, according to the Chinese medicine, it's the internal stages, early stages of colds and flus and so on. It also tells us something that it's a bit like bringing things inside, hericium. And here are the citations. So some for digestion, liver and stomach support, brain and nerve cell support, and antibacterial effect. Yeah, and now about Coriolus, it's the other guy from the hericium and Coriolus combination, so now Coriolus. So again, it's good to remember Coriolus as a natural, really strong antiviral mushroom. I even suspect there's something stinky in the European Union and that someone put the Coriolus on the novel food list because it's really effective against viral infection. As you are familiar, it's herpes, human papilloma virus, herpes simplex virus, and Epstein-Barr virus. And you can find such a nice Coriolus in the woods. This one is from our garden at home. Yeah, it's an old one. This one is from California. Maybe it can be eating your cottage or wooden structures. It has really strong enzymes to decompose the wood. This is really strong thing about the mushrooms, which are able to decompose. They are the wood-eating mushrooms. So they have a really strong profile of the enzymes that can decompose. And there is really strong, or there is evidence of virus cancer link. So, and this is really old slide from the year of, yeah, it's 90s or early 2000 something. So meanwhile, some other carcinomas were attributed to the HPV, human papilloma virus. It's very likely that those new usage or were found because there are vaccines, so there's a lot of money for the research. So all these viruses are a bit answered by Coriolis. You can use even Coriolis in acute phases of the herpes simplex. Once the people start to feel something is growing in their mouth, nose, or whatever, they can have eat the high dosage of the Coriolis, and it will stop, you know, from progressing. Yes.
Can one use Coriolis alongside chemotherapy?
Yes. In between, you know, not the same day. Yeah. The only thing is, as we spoke earlier, Coriolis is a bit, there was a contraindication of weak spleen. So once there is a side effect of the chemo, is, you know, vomiting, nausea, and so on, then it's not clever to add Coriolis. You know, it can be combined. Giovanni Maccioccia has really nice chemo support remedy, chemo support. Giovanni Maccioccia? Okay, yeah. So it's really good to use these two in combination. Yeah. So you can add it to any Chinese medicine formula, Coriolis. On the terrain, as we said in the beginning, it's the second slide, and the terrain of vacuity or deficiency of liver, lungs, and kidneys, especially yin deficiency with heat signs. Coriolis is not supplementing yin, but it can work with the heat within the yin deficiency. So it's really great for to combine with any TCM yin nourishing strategy, acupuncture, tuina, and even dietetics. Yeah. So there is the antiviral effects which are documented for Coriolis. And not only, it's really good for the chronic conditions of the viral load. This is the case of the chronic fatigue syndrome, when there is very often, or it's very unlikely, there is no viral load in chronic fatigue syndrome. There always is, because when the body is in good health and condition, it can get rid of the viruses. And when it's weak, they persist somewhere and are like keeping the immune system from returning to the homeostasis. So that's really interesting. Again, with all your strategies for chronic fatigue syndrome, it would be really clever to add Coriolis to it. Interesting thing is leaky gut syndrome. There will be another slide for this. And nutrition in palliative care. Yes, it can serve as a standalone thing, especially when the case is not from blood stasis. When there is pain from blood stasis, it doesn't move blood, so it must be combined again. And it can be used even in animals. There are many vets who are using it for palliative care of animals with really good results. that even the dog starts to eat again, is strong again, and after a while dies happily. And the same applies to humans.
I used Coriolis on one of my dogs for 4 years, and she had a large breast tumour.
Mm-hmm.
That big, and it kept it the same size in 4 years.
Yeah, that's it. Yeah.
We went away on holiday. We didn't give the mushrooms to the people looking after her. When we came back, it had trebled in size.
That's an interesting thing because the breast cancer is attributed to the Epstein-Barr virus. So not only it's like the Coriolis in terms of the Chinese medicine, Tchan Qi Yu Tie, like qi and phlegm together, binding together, but it's also the antiviral property. So again, it's like two pathways in one mushroom, or even more, because it then works on the microbiomes, and this creates again certain other effects. Yeah, that's Coriolis. So you know about Coriolis. That's the image you should keep. Yes. Okay, so in all the breast masses, I don't want to say cancer, but even that it's like Qi stagnation, it's always yes, thank you. Yes, it's always clever to add their Coriolis, because from what we understand, you cannot have these masses, especially in breasts, without having the viral load there. And the antiviral effect, it's proteins. It's linked to the proteins compounds in the mushroom, and proteins are sensitive to the heat. So when are you using Chinese medicine formulas, which are hot water extraction, or it's like a tea which was decocted, then you are really losing, even if there is something which has the proteins which would have the antiviral properties. So then it's like decreased or even damaged by the heating. So when the mushrooms are not heat treated, they have these proteins preserved. So it's that's Coriolis. It grows in the wild. You can collect it. It's really difficult to chew it, and it's very often there are other stuff in it because it's a really slow-growing mushroom. So it's good to have someone who grew it in controlled conditions. Yeah. So again, there is this is a Western medicine approach, which is about the lipoxin A4, which is interesting compound, which sorry, yeah, just shout, wait a minute or wait a bit or whatever, yeah. And this lipoxin A4 helps to avoid of the oxidative degeneration of the brain. So this is really strong evidence, and the Coriolis then can be used even without matching the Chinese medicine constitution. You know, because the Coriolis is really strong in its antiviral properties, and it's very unlikely you will have serious health conditions where it's about the immune, that the immune system is suppressed, that there wouldn't be a viral load. So it's always clever to add Coriolis. Yeah, there are results from the study, and again it was done directly on the mycology laboratories Coriolis. So when we eat this one, we can be sure it works. because sometimes China has a legal requirement that everything what leaves China must be heat treated. So when the biomass might be of Chinese origin, it's good to approach the distributor and to ask whether it was or wasn't heat treated. Because as you see, the LXA4 increases certain sensitive proteins, like the heat shock protein and the other two. So it's just the same thing in other slides. Yeah, I was pressing the wrong button. And here we see like different parts of brain: cortex, hippocampus, cerebrum, and total brain, with and without Coriolis. And we can really see that it supports the LXA4 content, which means the brain is then able to better detoxify, to get rid of the metabolism compounds from, yeah. And again, it's just LXA4, but then we have the viral, antiviral effect and so on. So it's really unique to the Coriolis. Yeah. We see that it doesn't work too much on the kidneys or liver. Yeah. That's the same thing, same charts again, saying the same thing. It just, you can see it was, the job was done on Coriolis. And the dosage, recommended dosage would be the combination of Coriolis and Hericium, and it would be like 3 grams a day. And it's like the higher dosage for dementia to stop the progression and maybe even induce regression of the progression. We need the higher dosage. So in total, it's like 6 grams of mushrooms, free of Coriolis and free of Hericium. They can be combined together, or can be used Hericium, some Hericium and Coriolis in the morning. In that case, I would like to see more Hericium and less Coriolis. And you can, and for the night combination, before going to sleep, you can have more Coriolis and less Hericium. And why more Hericium during the day? It's like working with the stress, helping to calm organs, as we had in the previous section. That's just the only reason why to differentiate. When the patient doesn't want to differentiate, or it's too much for them, you don't care. Also, when someone is taking big lunch or big meals, it's better not to use it together. But with children, they don't eat much unless they are in the puberty. So then you can combine. When you have a short amount of time during the morning, so don't be stressed by, trying to figure out, some time between the meal and the mushrooms or herbs. What we do in our house, we have a breakfast, and then when we leave the house, we have there, the keys are hanging there, and there are the bottles with the mushrooms. And just when we go out and go to the car, so the children chew the mushrooms or the herbs, and so I think in all you can find in the daily program moments where there is like a calm, so they can chew it in the car, or you can have it in the car. Sometimes even our kids have it in the backpack and take it by themselves in the school or in the kindergarten. We have well-educated children.
So do you give it to your children as a preventative?
Sorry?
Do you give it to your children as a preventative?
Yes, yes, but with the children, there's always something to address. So either I ignore it and then they go without anything, because I think, yeah, it's okay to ignore it. And when I think it's not good to ignore it, they eat something, you know. Yeah, it's really, yeah, with the children, they are always either getting out of the disease or getting into the disease from the TCM point of view, or there's a weak immunity. For the weak immunity, Coriolis could be used as preventative thing, especially again. I like low dosage over the night, just before the sleep. There was a chart in the morning that the immune balancing thing is done in low dosage, and especially during the night where the body is not disturbed and everything is taking slow pace. This is even how we are able to digest vitamins and trace elements, that from these traces of the elements and vitamins we are able to gain a big amount of effect, and that's overnight. Yeah. And so it's also good not to eat too much, because then instead of digesting herbs and working with the active principles, it has to bother with the fat, or the chips or whatever. Yeah, and here is a really nice poster. It's about yeah, and it's enlarged, and this is the neurons, and this is with Coriolis. So you can see it. It's not only about the length, like the neurogrowth factor, but it's also about branching. So it promotes branching of the neurons and it makes them yeah, more length. Yeah, okay, you understand. There is a link between herpes simplex virus and Alzheimer's disease. So again, it's Coriolis, and it's the viral link. There will be also other viruses in Alzheimer's disease, and again, that's why Coriolis is really part of the combination. That's why we speak about Hericium and Coriolis in combination. That Coriolis part is really yeah, it's doing the branching, but it's really strong in the antiviral properties. So now we really, yeah, and here are the citations. So immunomodulation and adaptogenic effect, antiviral effect and anti-tumor activity, antiviral effect. Yeah. This slide is here just that Coriolis is on the novel food list of the European Union. So this is a nice article which is about safety of the Coriolis biomass. So sometimes, yeah, it's necessary to have a proof, and we are really happy that this group did such a nice work. It's from 2015. Yeah. And other interesting thing is the prebiotic effect of Coriolis, because Coriolis is known for its usage in leaky gut syndrome. And there's interesting thing about the intestinal cell wall. There's a phlegm, mucus, which is there is a symbiosis between this bacteria, Akkermansia mucinophila, which means mucinophila like the mucus-loving bacteria. And they together, the mucus of the intestinal wall protects the bacteria, and the bacteria like helps the mucus to be together, so it grows in it. So, and there's really strong studies on this bacteria. So in people with metabolic disease, diabetes, and whatever inflammation, when they orally give to these patients this bacteria, it really improves their condition. The only problem is once they stop, the condition gets back. And with Coriolus, again, we now understand that it's more multi-approach, and one of the Coriolus effect is possibly that it stimulates this mucus or the bacteria, and this is what then protects the cell wall or the intestinal wall from being leaky. So it's nice explanation how Coriolus works against leaky gut syndrome. That it's, and again, it's the immunomodulation. There's something wrong in the guts when there's an inflammation, and again, Coriolus is again effective against inflammation. But also, Hericium works against inflammation. So it's interesting to combine them together, and yeah. This is difficult. I would expect that from our citizens' taxes, the research of food ingredients are done in the universities and state agencies, but it's not so. We are lacking the evidence how food and wholesome food is working. You know, everybody goes for active ingredients and not for the whole things. So it's the prebiotic activity. And another thing that there are already articles that the psoriasis is linked to the leaky gut, that it's a microbiome thing. And that even there are like hypotheses that it's a bacterial translation or transition to the bloodstream. And again, psoriasis could be really hard to treat, of course, but it might be the trigger point to add Coriolus to what you are already doing. Sometimes you can like control the condition, but you cannot go beyond the point it starts to heal. And very often mushrooms can be the trigger point which starts the immune or supports the immune system to get rid of the disease, or at least it helps to control things. And you can play with the proportions of herbs and mushrooms. Sometimes maybe they might have according to the season. Maybe they will go to the South Europe to swim in the sea. So at that time, they might just use only Coriolus. And then when they come back and the condition gets worse, they again can be on herbs plus the mushrooms. So it's interesting. There is interesting thing that not only antibiotics affects our bacteria. We would suspect antibiotics affect the microbiome, but it's also other non-antibiotic medications. and it's from Nature. So it's a sound article. And also all the preservatives, because it preserves the food from being degraded by bacteria, and the same effect it has in our guts. So whenever we see, and very often it's more harmful if you have more antibacterial stuff in less quantities than one in big quantity, because the cocktail is much more wider targeted. So it's sometimes they say, oh, there's only a little, but there's only a little of like 5 of them. So then it's really it's targeting the gram-positive, gram-negative bacteria, and it's really creating really broad effect. So yeah, Chinese medicine and Coriolis. So disorders of the lungs. Especially in terms of the lungs functions according in connection with the defensive qi, with the obrany schopnost. Never mind. So the thing is, what the lungs do, they spread the qi, and it's a final place where it separates the slightly unclear qi and the really clear qi, and the really clear qi goes to nourish the defenses, the defensive qi, and this is what Coriolis does. It helps boosting the clear qi. It can be used especially in the conditions of the Kanshen Yin Su, liver and kidney yin deficiency. But it's not supplementing yin, but it can be used in this terrain. Works on the spleen and heart. Slightly leads out the dampness. And usually it was used for the lung cancer. Reduces inflammation, clears heat, like especially the residual heat, not like that you would have the full heat, that it's not the Coriolis case. Again, it's like the difficulty that the mushrooms, they have less strong effect, so it's sometimes difficult to describe them in terms of Chinese medicine. So it clears deficiency heat and remove toxins, especially the hidden toxins, Foussier, lingering pathogens. And it's the chronic fatigue syndrome, it's the last one. So it's mild combination of supplementing and the xiao clearing. So this is, from our point of view, this is Coriolis. It describes the anti-inflammatory effect and the toxins. It's Coriolis. Yes, because the viral load is part of the problem, but the mushrooms are really great in one thing. Thank you for the question. Because when you give them formulas or even do acupuncture and support their qi, they will burn it in what everything they need to do, and then they are in much worse condition than they were. And with mushrooms, it helps you to balance that the mushrooms can do what we saw, but it's not strongly supplementing the qi. So they won't have the energy rushes to do the stuff. So it's really good for maybe once they get better, so you can choose one mushroom or change the mushroom again according to the seasons or to the health status. So maybe they end up with 3 different ones. At the end of the lecture, we have nice case study with one family and 4 women, 1 mother and 3 daughters, and you will see they have like similar constitution, and all of them, each of them has a different mushroom, you know. So yeah.
Can also cross the blood-brain barrier and clear out the environmental toxins?
We are sure with the mycology research hericium that it crosses blood-brain barrier in the meses. Yeah. So, and from the clinic we already see results that it's crossing in humans as well. You know, it's there's only not a trial. Yeah, but with chlamydias we have a practitioner in Czech. This lady is using Coriolis a lot with all other Chinese medicine formulas and with Poria, Fuling, and or in combination with Juling, Polyporus. And there is proofs from the lab that the chlamydia is cleared in really hard cases where the Western medicine was not successful for several years. Those people were not able to function, and Coriolis is really core of the treatment. So it really, and it's the chlamydias, not only the which live in the urogenital area, but also the lung chlamydias, and then they sometimes go even to the eye. So in some patients it was even possible to see it on the eye, and it was cleared out. So it's really like pieces of strong evidence that it works there. Yeah. And this is a nice question. Thank you for it. Yeah. It's not as strong in the qi stagnation. It's Coriolis, but it's great when there's combination of qi and phlegm stagnation with a bit of empty heat. But it cannot be used alone in those cases. But it's again, it's really great to be used in combination with other TCM methods or approaches. So here there are some combinations. Yeah, you can get the idea from the points. So whenever we are supplementing liver or kidney yin or clearing empty heat, Coriolis can be part of the solution. This is true, especially when you have a patient, let's say elderly lady, no elderly, middle-aged lady, yeah, with dampness around the ankles, a bit more, with more weight. So we will see dampness and phlegm, but she will be tired. So then there is very likely there will be also a viral load, especially when such a patient has something which is like chronic fatigue syndrome or has the elements of the fatigue. Then you can do something with acupuncture, and Coriolis works pretty well in the terrain of dampness and phlegm, despite it's not transforming dampness and not transforming phlegm directly. So here we have a case study. That's yours.
joint pain, from sore throat, dry cough, and had swollen and painful glands. In the afternoon, she used to have low-grade fever and suffered from sweating during the day, sometimes during the night, and sometimes she suffered from dizziness, from insomnia, and blood test, you know her, showed high antibody levels against Epstein-Barr virus, herpes simplex virus, Borrelia, I think cytomegalovirus too, and it's serious. She had high blood level of liver enzymes. I remember this girl wasn't able to go to school, and she wasn't able to read more than one list. And Western medicine diagnosed some rheumatic or dysphatic chronic fatigue syndrome, but nothing helped. And diagnosis according TCM, you see key stage, EC, spleen and lungs, Chi deficiency, Fussie is lingering pathogenic factor, and VHC deficiency of protective defense Chi. And my aim to treat was nourished Chi and blood, to have something to flow in meridians, in channels, tonify spleen and kidneys and lungs, and expel Fussie. It's true, it's a very serious situation. It was a serious situation, and my choice when we talk about mushrooms was coriolus and reishi. Both of these mushrooms have antiviral effect and supplements kidneys, strengthens body. Reishi supports sleep and mental activity, and recovers Chi and nourishes blood. About coriolus we listen everything, and sometimes I combine mushrooms with herbs formula, sometimes with homeopathy, and this girl slowly got better and better, but very slowly. We worked, I think, 2-3 years together, but it's a very long time. I met this situation. I met her now last month. She's 35 years old. She has one child and she lives in Canada. Once repeated this situation when she decided to go to school and to work together. But she came back to mushrooms, and it's, I think, satisfied now. Very difficult, serious situation, but I think mushrooms was this who helped. And one more. Yeah.
Yes, it's not on the slide.
One more example, because I think it's good to repeat this effect of coriolus and against autoimmunity. I remember my one patient, girl, 13 years old, with autoimmune inflammation of thyroid glands, and clinical signs showed hyperfunction. She was thin, nervous, inattentive, had poor concentration, Sometimes she felt palpitation, was sweating during the night. It's signs of hyperfunction of thyroid glands. And she was treated by Western medicine with poor effect because this exophthalmos was visible during this treatment. And according to TCM was yin deficiency, stagnation of liver chi, and lingering factor. It's listed here. And I decided to supplement yin using Liu Wei Ti Huang Wan with basic formulas to nourish yin. And sometimes when she was very nervous, I recommend her Kia Wei Xiao Yao Wan for calm liver. And Coriolis to affect this autoimmune inflammation. And she used this combination for a long time, I think near 1 year. Her condition got slowly better and better, and dose of drugs according to Western medicine could be gradually reduced. And doctors stopped talking about surgery, operation, because first was that it's necessary remove the gland. And it's one of my cases, and I used to recommend Coriolis regularly during the therapy this autoimmune inflammation, mostly with thyroid inflammation, joint inflammation. I remember our 2-year-old boy with juvenile arthritis. It's good effect of Coriolis, and large intestine, of course. I have good experiences with using Coriolis, sometimes with combination of Coriolis and reishi, ganoderma, in this in condition with this last girl, I combine it. Here only Coriolis.
Yeah, we don't have time to go through ganoderma, but I think it's like well-known mushroom. So yeah, I think you are getting the picture. The ganoderma, when compare the ganoderma and Coriolis, ganoderma has the blood thinning effect. So very often it's not suitable for certain conditions, and this is not the case of Coriolis. Yeah, this might be one really big difference. And the ganoderma in this combination also supplements the essence of kidneys, especially in women. So, and also calms the Shen and works with the connection of kidneys and heart. So, yeah, I believe this is important to women. Yeah, yeah, okay. So that was, and really Coriolis and TCM formulas for supplementing yin, it's great to combine them together, or any formulas which address the empty heat. And even you can use them together, and then once the condition gets better, you can get rid of the TCM formula and you know, be on the mushrooms because of the complex properties, the enzymes, antiviral effect. Yeah. So it's just that we were repeating this summary of what we did until now. So it's hericium and Coriolis together. we see what they do in red, what they share, and in the colors it's the unique effects of each mushroom, and there is the main articles of reducing the stress response, and one it's like similar. One has Coriolis and the other has Hericium, and yeah, that's small advertisement. Sorry about that, but I like the product. So there is a Hericore, which is a combination of these two mushrooms together. It's 50 to 50, so you don't need to buy like two different mushrooms. It's already in one product. Yeah, I don't like capsules because yeah, it's a powder. Because you can play with it with the mouth and with the saliva. It already, you know, has an effect. You know, and when you want to have the effect near the brain, it's really clever to play with it in the mouth. You know, because then it's too long, too long way. And in the last 15 minutes, we will try to do the next section.
You have some question?
Oh, sorry.
Just a very quick question about giving it to children. Can they tolerate it?
Yes.
Is it like?
It has really nice bland taste. Yeah, it's. I think it's more the thing of parents. Yes. Sometimes parents create children which don't accept things. Yes. Yeah. So yeah. I think it's the case of the parents, because in our household, you know, even our children are unhappy with me and telling me that it's the best sweet I gave them, and that I should give them what I gave them like already 2 days ago. You know, so yeah, it's they can chew it, they can play it. Sometimes some of the children like the tablets because they can chew them, and yeah, normally I put the powder. They stick the tongue, and I put it on their tongue, and just they have to learn not to breathe when you use the powder, because otherwise breathe out, that's okay, it's everywhere, but if they breathe in, you know, it makes them cough, you know. Yeah.
Sometimes it's possible to take them with eat.
Yeah, yeah, but as we were speaking about the prebiotic effects, you can with yogurt, yeah, and yeah. But I don't like the idea of hiding the thing, because that's wrong. Yeah, it's yeah, it's cheating. Yeah. So, and even with the mushroom, that's great. The children especially can, and sometimes even adults, they come to say, oh, there's something wrong with the mushroom, and completely changed the taste. They were eating it for 3 months, and now, or 3 weeks, whatever, and it completely changed the taste. I don't want it anymore. And that's just the response of the bacteria working with the brain. You know, it says enough. You know, so it's really interesting that you can observe such reactions. It was that they report there's something wrong with the bottle. Overnight it changed the taste. You know, and especially children, they say, oh, I don't want it anymore. So don't push. Make them part of the diagnose, of you know, setting up the diagnose, because very often they know that they don't need it anymore. It's really interesting. Yeah, okay. So for 15 minutes to go. So here is this table, and yeah, we skip this. There's the metabolic disease classification, so it's obesity, cholesterol, and diabetes. The obesity can be the damp heat or damp cold, cholesterol, Yeah, it can be everything, either of the excess or deficiency. In diabetes, it can be many things we will see later. This is from the Bob Flaw book, The Treatment of the Diabetes. It's just for you to look at it a bit, because when maybe you have the handouts at home and maybe the book, or you can take a picture, so you will see in how many places you can place the effect of the mushroom or the mushroom combination, that it works in the accumulation of heat in the stomach, that it's nice to the yin deficiency and internal heat, that it maybe does something with the fluids. And normally, when you have Chinese medicine formula, you would address just certain principles. So the mushrooms really have a really nice broad effect. Yeah, it's the treatment of diabetes. It's a thick, big book. And there is another, it's just from the organs point of view. So again, with Coriolis, we especially work with liver and lungs. We have a hericium, liver, stomach, and spleen. Where is spleen? There should be a spleen. Spleen's not there. There's something wrong with this with the chart. So it's really interesting. It's just for you the idea how to approach the mushrooms. And there is one mushroom which would be the first choice in the metabolic syndrome. Again, one mushroom covering it all, which is maitake. It's really nice mushrooms. It also grows here. It's, yeah, and it's really good for visceral obesity, because everyone is scared of what they can hold, yeah, the fat, but the more dangerous is the one around the organs. So, and again, it's damp, damp heat, accumulation, water, phlegm, and for all of this, maitake is really great. And we will see later, but I say it now, that maitake can be used in damp heat. It can be used in damp. It can be used in heat conditions, and it can be used where there's no damp heat, and no heat. It can be used as adaptogenic mushroom. So it's really interesting how flexible the mushrooms are and how delicate they are. So they come to the body, you eat them, and they look around and say, oh, what we should do, and they do it, you know. So I really like, maitake is really great mushroom for the metabolic syndrome. Sorry, yeah, go ahead.
To shift to metabolic syndrome to help you is the fat that accumulates in the arms and over the shoulders and on the back. I very often can get the middle child here, but actually this seems to be very, very hard to hear. What are any suggestions?
The thing is that maitake doesn't have the warming qualities, and it's the surface area which should be warm. So I would maybe suggest to choose a formula which has something which guides the warming effect to the shoulders, or using moxa. Yeah, to warm, it's what should protect us. And then you use the heat, but then the body should move it. And then that's a place for mushrooms. So I think in that case, such a people can be on mushrooms which work with water. Or, it's maitake, can be the poria, because it's fulling is really unique to in that it works with the water across all three burners. And poria fooling goes well either with the cooling strategies or warming strategies. It's really nice mushroom. But unfortunately, it's not part of the lecture. Yeah. Okay, so this is especially the damp heat. Again, inflammation, high cholesterol, hypertension, high triglyceride, insulin resistance. So according to the TCM, there are the characteristics. You have them in the slides. I just ran through them. It can be used in the tumors or enlarged, not tumors, it's too strong, enlarged prostate, because it not only works with the damp heat, but there is also part which is a viral load. And again, maitake has antiviral properties, and you can combine maitake and Coriolus. And maybe add it to what you already do. Or distribute it, 2 weeks, or finish a bottle of maitake plus Coriolus, and then do the formulas, and you can be creative. Yeah, and there is this slide. There is the syndrome X, which is the Western medicine concept. Its chief components of the metabolic disease are the obesity in the waistline, glucose intolerance, hyperlipidemia, and the most 6 deadly diseases of the old age, and all of them are covered by maitake. These are strongly covered by maitake, and these less strongly. So it's maitake. For metabolic syndrome, whenever you see it, maitake is a really good thing. And whenever you see such a tongues showing the damp heat, so maitake. There is no doubt. There is nothing to do wrong with such a tongue when you put there maitake. The tongues shows different, it's a damp heat of different origins, but in all of them, even here you can see some code, lacking of the code. Even in the terrain of the yin deficiency, it can be used. There is much more of the coating. It's much more turbid coating, not clear one. It doesn't need to be yellowish, it's just unclean. The dosage for the time for this slide you don't have there. It's really clever to administer maitake in the water time. So it's between 3 to 7 p.m. So basically in this time, people very often have the low downs in terms of energy. So maitake is supplementing energy, but also it works with the water. So it's clever to use it, yeah. There is the English tea and some after it, Yeah. That's good because, the black tea is transforming the dampness as well. But it's not clearing heat, which maitake is doing. And there is interesting the senile diabetes. It's let's come here. Senile diabetes, which can be for especially of these syndrome elements. It's diabetes which starts after 60, and very often it's not only one syndrome element of these 9, but you see that out of these 9, 92% it's 3 to 5 syndrome elements. So it's always a mixture of the pathomechanisms or the conditions we see. And all of them can be covered by maitake. So there is a really strong correlation between diabetes, second type, and Xiao Khan, the sweet urine, as it's called in Chinese medicine. And in terms of Pakang, 95% is combination of full condition and empty condition. So again, it's great to use mushrooms, because very often with the Chinese medicine formulas, they don't work on both the vacuity condition and the full condition. Yeah, some of them of course do, but the mushrooms are suitable. And you can, this is just playing with different syndrome elements, that you can have like vacuity of qi and yin, so you can maybe do something with herbs or other acupuncture, and for something use the mushroom. So it's just playing different mushrooms for different conditions. Yeah. Yeah, maybe you can take picture of this slide if you don't have it, but you have it, yeah, because this is important slide. So you just, this is Ganoderma, Coriolus, these two you already know, you have the pictures in the slides. This is Auricularia, the Judas ear, Maitake, this is Chaga, Shiitake, and Pleurotus, the oyster mushroom, and Cordyceps, yes. The Cordyceps is this stroma growing out of the caterpillar, which is not present in the biomass. They convince the mushroom to be vegetarian. That's interesting, because normally you might end up with the mushroom and the caterpillar. You know, it grows on, insects.
So it has the same effect, even though it's not.
Yes, 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 yes. That's interesting. It really ruined the business of those making the fake cordyceps. And even in China, they started to use not the cordyceps which grows in the high elevation in the mountains, but they use the one which grows pretty on almost every insect. The red one, it's called Cordyceps militaris, and it's a red cordyceps. The stroma is red. Normally it's shadowy, dark, I don't want to go there, it's a big topic. So there are differences between the mushrooms. You can go through it by yourself at home or in your clinic. Yeah, we have a case study there, but actually the elderly lady was the maitake. She had all the things we were speaking about. And there is the oyster mushroom. Yeah, 5 more minutes and you can go home. Oyster mushroom, when it's like a first choice mushroom for normalization of cholesterol levels. Even like balancing both cholesterols, or now even they start to differentiate a new one, like normalizing the cholesterol levels. It's really pretty nice term. The oyster mushrooms grows in the wood, especially during the winter time. So this is somewhere around our house in the woods, in Czech. This is before I collected it. Then we had a really good meal. Yeah, so that's oyster mushroom for cholesterol. And yeah.
And it works for familial hypercholesterolemia?
Yes, this is the case study we are not going to skip. So we will see it there. What is really good for oyster mushroom, this is what I want to say, it's one of the mushrooms which can be used during the acute conditions of on the surface. So it expels wind cold, and especially in children when you don't know what to give them during the winter time or autumn, when there are the cold winds. Pleurotus oyster mushroom is a really great thing. Or for sportsmen who like jogging, so it also relaxes the tendons. I know that here people are running around the coastline. I used to do it as well. So those people can be using not only whiskey, but also oyster mushroom. Because whiskey is working inside, and the oyster mushroom can really work with the surface, expelling the wind part. It's important. Yeah, there were some jokes, but we will go to this familiar, I don't say it, yeah, this one mother and 3 daughters, high blood levels of cholesterol, yeah.
I think this mother and 2 daughters have high blood level of cholesterol. Blood pressure is in a normal range, and examination of carotid arteries was all right. And Western medicine, doctors recommend them statin type drug to use. But these drugs used to have big side effects. Every suffered from joint pain, from headache, dizziness, digestive problems, and they decided to stop using. And but high blood level of cholesterol, and they a little worried about their health, and they visited me to ask some advice what to do. And each woman was aware of different constitution type. Mother, 55-year-old, was obese, suffered from poor appetite, tired, digestive problems, like feeling distension in abdomen, soft and stinking stool. Her tongue was red with thick yellow coating. We remember maitake. Yeah. First daughter was fatigued too, but she had tendency to diarrhea, felt swollen himself, and has cellulitis, and sometimes lost appetite, and liked to eat sweets, and it was she had swollen tongue with teeth marks, and it's image for chorea, fooling.
Yeah, even whenever you see the teeth marks on the tongue, it's called a fooling tongue. So
not red.
Not red, swollen. No change in color, pink, not too much of yellow. Mm-hmm. That's a fooling tongue. The nice thin coating without yellow. It would be. Yeah. Okay. I'll show you one picture later.
Second daughter was often ill, fatigue, and feels muscle tension in muscle, tension in tissue, and felt sensation of mucus in the throat and the stool. Tongue was pale, slightly swollen, thick white coating, and it was image for pleurotus, for pinku. And third daughter suffered from allergic cough with phlegm. She was tired, feeling uncertainty and fear, suffered from insomnia and felt pain in back, lower back. And it was image for ganoderma for reishi because of support of kidney and stop cough, and ganoderma has anti-histaminic effect, and it was the same problem but different mushrooms. Yeah.
Okay, you can also combine them according to Chinese medicine when you want to work with brain, with heart, spleen, and kidneys formulas or acupuncture approaches. And Giovanni Maccioccia has a really nice remedy which is called Peaceful Sunset. And because that in the elderly, the old people don't die of deficiency, they always die of some full conditions like phlegm, blood stasis, or internal wind. And in these conditions, whatever you use, it's always clever to include mushrooms. Or not include like every day, but maybe let the mushrooms be part of your long-term strategy. Maybe during the year there will be a period of time when the mushroom would be part of your treatment or treatment of the patient. So yeah, it's a nice remedy. So I would thank Giovanni for such a nice remedy. And here's the last. Please take the pictures, because this is what I did on the plane where we were coming here. So it's the same chart, but you can see we can use mushroom nutrition and TCM for diminishing the risk factors. We can use mushroom nutrition for better benefiting from the protective factors. We have our life divided into the first 60 years when we are balancing organ functions, and to the second 60 years where we think about the pathogens, which means like this blood stagnation, phlegm, and internal wind. And then in the middle age we are thinking about the metabolic syndrome, which is maitake. So it's a absolutely great summary of the lecture. Thank you very much for your attention. Should you want to get in touch with us, you have emails there. Please don't write long emails. And yeah, thank you very much for being with us. Yeah. I just want to show you the fooling tongue. I just, connected here. I hope I can. Yes, it's Justin Bieber. He has really nice fooling tongue. You can see that's it. The teeth marks slightly swollen. The coating is there, present, and white. So, nothing fake. That's a fooling tongue. Don't tell him, otherwise it will be expensive.